Hello! So it's Friday evening and Ollie and I have just scooted across the gap.
Hello.
We're on the way to Michael Honey's. There's Ollie.
Stuck in traffic.
Yes.
Joys.
Traffic lights between Donegal Town and the gap. So yeah, we've just finished work and we're running over to Michael Honey's. We hope they're open late this evening. Ollie has to get a suit for Galen's wedding. A friend of ours is getting married in nearly a week now. Anyway, today in Physio we did in-service training on pelvic girdle pain. So this video is to give you a few tips if you're pregnant and having pain in your pelvis, which is at the bottom of that back or in the front around the pubic bone. So if you're not pregnant, sorry, this is probably not for you, but if you know someone who is or that's struggling, then let them know this video is here, because we're going to go through what it is and what you can do to help. So pelvic girdle pain happens for a few reasons. The first is to do with hormonal changes. So from week 10 of your pregnancy, there's a hormone called relaxin, and we start producing it more from the early days in pregnancy. There's two big joints in our pelvis called our sacroiliac joints that are usually really stable. The tissue that holds them together, the ligaments, are really strong, and the studies show there's actually minimal movement between those joints. When we produce relaxin, the tissue softens slightly, and this has to happen because we have to have a little bit of separation within the pelvis in order for the baby to come through the birth canal. But the problem is when we have increased relaxin and the ligament softens, we don't have as much stability in those ligaments, and they can start to give us problems and pain. So the first reason we think pelvic girdle pain starts is to do with hormone production. The second thing we think is causing the problem is a combination of the increase in weight with the baby in front and then how that affects your posture. So we know that standard posture that women have. They are lordotic in their back. We are now moving. So yeah, the first reason we think they get problems is because of increased production of relaxin. The second thing we think is to do with how, when baby gets heavier and starts to grow, how the weight in front starts to change mum's posture. So we see this, they start to arch their back more, and I think that definitely changes the pressure through those joints at the back of the pelvis and starts to give us problems. And that, combined with the fact that your tummy muscles in front are stretching and really aren't giving you the normal stability in front. So I think the posture change combined with the tummy weakness with hormonal changes, we think the research is still out on how hormonal changes affect it, because not only 1 in 5 women are affected by pelvic girdle pain, but every woman gets the hormonal changes and they don't get pelvic girdle pain. So we're not sure, but we think it's a combination of those factors. Whatever causes it, it's really frustrating for the mum because they're going through their pregnancy and they have this pain that they didn't have before. So what can you do to help? Well, the first thing we would say is that expectant mums experience this pain from early on in their pregnancy, but they often don't report it until they're at a point where they're struggling to walk or they're struggling to do their functional activities. So the first thing we would say is notice the early signs and get advice and help from then. The second thing is that we do with our patients is huge. It's about education. It's about giving you tips and tricks to minimize that pain around your pelvis. Like a simple thing is when you're getting in and out of the car, in and out of bed, to try and keep your knees close together, because if you swing your legs apart, that puts more pressure on the sacroiliac joint and causes pain. So keeping knees together is a simple strategy to reduce pain. Other things like when you're lying at night, lying on the side with the painful side uppermost with a pillow between your legs, so comfortable positioning, and also trying to avoid crossing your legs. That puts increased pressure on that sacroiliac joint as well. In terms of activity around the house, it's been sensible, so trying to break your hoovering activities up. Don't stand for too long, don't sit for too long. There is one thing across the board in all the guidelines with pelvic girdle pain: it's about movement and exercise. We know now that the more active you stay, the more you can get on control of your pelvic girdle pain. But what we find in clinic is that mums are afraid to move when they get the pain. They often say, I spoke to the doctor and they told me not to come to class if they're doing our Pilates class, but actually the opposite is true. You need to come in and get that exercise, because that will help the muscles around the pelvis, which then will help the pain. So simple exercises we give out are things like bridges and clams that we would do in our Pilates class, but we would normally assess what they expect mum is able to do and then give them those as their exercises at home. So keeping active and exercise is key. Other things that can help: management of pain. You can use things like heat and ice. Some ladies get relief from things like TENS machines, where we use little bits of electric stimulation to help. Anything that you can do to try and ease the pain can help. So heat ice, TENS machines. Sometimes we use tubing grip, so that's elastic support, and we pull it up nearly like support underwear up over the bump and around the pelvis, and that can help compress a little bit and relieve symptoms short term. If things are bad, we do give crutches if mums are really starting to struggle, to try and take a little bit of weight off, but that's at the later stages when things are more difficult. Anything else to add on that?
Just two things really. You said number one, break up the hoovering tasks. You could just get the man to do it.
You could.
It's very sexist assuming the women do the hoovering.
Absolutely.
And the second one, what about maternity belts? You forgot them.
Yeah, so maternity belts, actually belts in pregnancy for pelvic girdle pain are the one area where orthopedic belts and supports are actually advocated. So we know that back supports do nothing in normal low back pain, but if you're pregnant, there is studies to show the use of the belt during pregnancy can help reduce symptoms short term. Once baby's out, the belt goes. So yeah, in clinic, you're absolutely right, Ollie. We do give out maternity belts and we use them short term to try and help, and ladies report that they absolutely do. It's just a simple belt that you can put on under or over your clothes to help support the bump. So there's loads of advice. Education is key. Making sure that you stay active, pace your activities so you don't do too much in the day, and then using things like heat, ice, TENS machines, and your maternity belt can all help. I think the key message is that if you're getting symptoms early on, seek advice early. When mums come into us, or expect mums come into us with pelvic girdle pain, we also give them tips and tricks that can help during labour. We won't talk about that on the video, but there's loads of advice out there to help. So if you or someone that you know is struggling with pelvic girdle pain, hopefully this advice helped, and if you have any questions, then don't hesitate to get in touch. Now we're just outside McElhenny's. Here's hoping we can find Ollie a suit. We'll keep you posted. Bye! Say bye, Ollie.
Bye.